How does cystoscopy differentiate prostate conditions? Imagine peering inside your urinary tract with a tiny, illuminated tube to see what's happening. That's what cystoscopy does. It involves inserting a thin, flexible tube called a cystoscope through the urethra to examine the bladder and urethra directly. While it mainly looks at the bladder and the tube that carries urine out of the body, it can also give clues about prostate issues. Since the prostate surrounds the urethra, any changes in the prostate can affect the flow of urine, and cystoscopy helps doctors see these effects firsthand. During the procedure, if the prostate is enlarged, it can squeeze or block the urethra. The doctor can observe if the urethra appears narrowed or compressed at the level of the prostate. This is common in benign prostatic hyperplasia, which is an enlargement of the prostate that often causes urinary problems. Cystoscopy can show how much the prostate is blocking the urethra, helping to differentiate between different causes of urinary difficulty. If the prostate is enlarged or has become cancerous, it may cause a blockage at the bladder outlet. Cystoscopy allows the doctor to see if the opening from the bladder, called the bladder neck, is constricted. This helps determine whether the prostate is causing the obstruction or if other issues are involved. Sometimes, the procedure reveals irregularities like bleeding or abnormal tissue in the bladder lining, which could suggest that prostate cancer has spread beyond the prostate to nearby areas. While cystoscopy is not used to diagnose prostate cancer directly, it can identify signs that might indicate local spread. For example, if a tumor has invaded the bladder or urethra, cystoscopy can reveal these changes. It also allows the doctor to take tissue samples, called biopsies, from suspicious areas to check for cancer cells. It's important to note that diagnosing prostate cancer relies on other tests like prostate-specific antigen blood tests, digital rectal exams, MRI scans, and prostate biopsies. Cystoscopy complements these by providing a clear view of the urinary tract structures affected by prostate conditions. It is especially useful for evaluating urinary symptoms caused by prostate enlargement or cancer invasion, but it is not the primary tool for detecting prostate cancer itself. In essence, cystoscopy helps differentiate prostate conditions by visually assessing the urethra and bladder outlet. It shows whether the prostate is causing a blockage or if cancer might have spread locally. This direct visualization guides further testing and treatment decisions, making it a valuable part of the diagnostic process for urinary and prostate-related issues. Always remember, for any concerns about prostate health, consulting a healthcare professional is essential to get personalized advice and accurate diagnosis.